is Ms. Carly, and today's video is all about my 100-day post-op. Yay! So very exciting. So with this video, I'm gonna go over a lot of things, and also a lot of things I feel like a lot of the videos do not talk about. So I'm all about giving you as much information as I can for you if you're interested in doing this type of surgery for yourself. So first and foremost, I will honestly say the most important part of your post-op is not comparing your results to anybody else's. Just stay in your own process, number one. Okay, and of course, naturally, if you have any questions about your progress, like ask your doctor, send your doctor photos like it's 2021, if not the future for you, that, you know, a lot of doctors are via text, and you just text them photos of what's going on and they can quickly assess or have you come in. Or also mentioned in my last video is that this process actually was a lot more painful than I anticipated. Why I wasn't thinking it was painful? Maybe because a lot of the videos don't really talk about the pain other than your first 5 days post-op is painful. Like, duh, of course, that is the most painful. But just the residual sorts of like pain and discomforts that you're gonna have. So I will say I really felt like around day 60 is when I truly started feeling better, like better overall. Like I had a lot of issues like reaching, like from the lipo that she did like on my flanks up here. So just like little things. And also I feel like just movement in general was a little tender for like 60 days or so. That couldn't say that I couldn't do things. Like, of course I did things, but I really feel like, again, pinnacle moment, 60 days, I was like, wow, I'm starting to feel a whole lot better. One very important thing that I do want to talk about that I really feel like a lot of videos do not go into, and that is fibrosis. So not to be scared, it is extremely common. I feel like maybe so common that maybe everyone gets it to an extent. Anytime you have liposuction anywhere, if it's a lot of liposuction or a little bit of liposuction, it doesn't matter. So when, of course, if you've ever seen the procedure of liposuction, they're taking that tool and they're like going in and, you know, getting all the fat out. Your skin is actually coming off of your, I hate to say body, but it's coming off of your body. Part of your healing process is your skin reattaching to your body, as weird as that sounds. So fibrosis is, it can be a lot of things. It could be like hard little areas. I had a mild case on my stomach of my skin kind of like reattaching while the other skin around it didn't like attach as aggressively. So I kind of joke around, only because I know it's temporary, that my stomach kind of looked like Frankenstein a little bit. It looked a little funky because it was attached, and then I had like some areas that were still like holding fluid, and so it was just a little funky. And the hardest part for me again was, since I was the only person on my journey at the recovery home, and also the people I had surgery with that day, that I was the only one who didn't have a tummy tuck. So a lot of my tummy tuck surgery girls all have like the flattest stomachs. They're like showing them off, and here I am feeling like I have a Frankenstein stomach, like it's okay. I'll see you guys in 1 year. And also just knowing that it's gonna take a while. All those massages are very necessary to help with fibrosis, getting the fluid out, and all of that good stuff. How to tackle fibrosis. So clearly there's a lot of things that you can do at home if you cannot find like a post-op masseuse person. So I had actually bought a lot of like wooden tools and things like that. I watched a lot of videos on how you can like massage your stomach. Now I will say definitely until like that 60 day, and I feel like it's still kind of weird for me like touching my stomach. I feel like it doesn't feel quite like it's my stomach, if that's weird. So I don't know if it's like a mental thing, but it's hard to like massage your stomach when it feels weird on your own body. I don't know if that makes sense. You're most likely gonna get fibrosis, so don't freak out about it. It could be mild, it could be aggressive, it could be anything. Just know that it is extremely common. Remember, your skin attaching to your body again, which is what we want. So first I started to watch a lot of YouTube videos on how to do like self massages at home using your hands, using like wooden tools, and just using all sorts of things. I even bought a cavitation machine. Like I was like, I'm going hardcore, which I need to really get back into using the cavitation machine. But anyway, so I live basically in an area where nothing is available. Only lymphatic massages for cancer patients are allowed. And actually, I'm going to tell you something that's real crazy. One place I called, they told me I needed a doctor's note to get a massage. I was like, what? That's when I was like, these people aren't for me. But anyway, so I found a masseuse place that specializes in post-op massage about an hour from my house. So I've been going there and I've had 9 sessions so far, and they concentrate on my stomach because that's where I have a little bit of fibrosis and a little bit of the fluid still like hanging out in certain spots. But after 9 sessions, I will honestly tell you, my stomach looks 100% better than when I started. It's truly amazing how fast the results can be by literally just having 9 sessions so far. It started looking really good around 8 sessions. But anyway, so you definitely want to tackle having that, or of course, taking matters in your own hands and just doing them yourself at home, because there are lots of options. You just want to get things moving and grooving. Now, I will talk about nerve pain. Now, nerve pain, this could be really anything, or you could not even have nerve pain. So for me, I only have nerve pain in one area, and that is my right hip. It's like really deep inside. So I believe I mentioned it maybe in my last video. If I sometimes like to wear like a corset or a waist trainer over my faja, because why not? I'm going hard. That's what it's all about. If I have too much pressure on one of my hips, which I am pressing on a nerve. So I did ask, of course, my doctor, like, hey, I've been noticing this, and they mentioned it was nerve pain, and it was probably from too tight of a faja, or of course the waist trainer I was using. So that's just like your body saying like, it's too tight, like you're pressing on something. So right now I will say the nerve pain has gone down dramatically. My doctor mentioned that maybe the one hip is a little bit more swollen than the other hip, you know, which of course makes sense if the faja's pressing on it and it's not liking it. Okay, so my next thing is swelling. My feet are still pretty swollen all the time. Now, again, this could not happen to you. Like, if it doesn't happen, then God bless America, you're doing amazing. And a lot of people mention that swelling really doesn't start going down, and some people like 10 months. So when I know this, like, I don't get crazy about it. I just know like, hey, girlfriend, it's only been like 100 days. Like, you're doing great. Definitely besides my feet, I do feel like my calves and just legs in general are still swollen. I'm all about, like I mentioned, doing things from home. So I did buy a couple of things that kind of help assist with the whole lymphatic system as well as the swelling, and then also for my bed. I'll of course have links down below for like post-op and pre-op things with everything that I purchased in both of those links. But anyway, so I bought this waiver right here, and the reviews alone are insane. So of course it does a lot of like really cool things, but programs 0 through 2 are for lymphatic drain. Besides my feet, naturally I do feel like my thighs and my calves are swollen as well, but I really see it and also feel it most in my feet because no shoes fit me. Like, I always want to wear something really cute, and then I'm like, oh yeah, I only have like 4 pairs of shoes that fit me. But life could be worse, right? So at least I have those 4 pairs. I did buy this leg and foot, this whole leg, like, it's called the massager, but it's really just like one of those armbands when you get your blood pressure. It's just like squeezing and releasing to help with swelling. Next thing is that I bought one of those wedge pillows for my bed. I actually got it from Walmart. The wedge pillow is fantastic. And of course, it doesn't matter if you sleep on your stomach or on your back, it's still the same. So of course, for those first 12 weeks, I exclusively was sleeping on my stomach. And of course, that was just my way of life. And of course, just having my feet elevated with the wedge. What I will say now, since I am 12 weeks post-op, I'm officially given the clearance to not having to use a special pillow for sitting down, or of course I can officially lay on my back or sleep on my back, which is so exciting. But what I will say is that I feel like sometimes like my booty or my hips, they kind of just ache a little bit. So when I feel like they're aching and whatnot, I just sleep on my stomach. I'm still in a pillow situation. I feel like that's gonna be me for a long time. But I'm just listening to my body. All right, so one thing I did get for my car, and of course, if I was in a workplace setting, I probably would bring it with me to my chair as well. But I actually bought one of these like gel pillows right here. Now, again, I know I don't need to use a pillow, but I just felt like my car seats maybe aren't as soft or plush, and maybe I'm a little paranoid, I don't know, but I just wanted a little extra something to sit on. All right, so now I'm gonna talk about fajas, very tiny. I'm gonna dedicate a whole video to them because I knew what I knew going into this, and I still was like trying to find another way that was cheaper, and all I did was waste time and money in the process. All right, so what I will honestly say, and this may sound a little harsh, so do not take it personally, what I'm about to say, I'm gonna get real with you. If you can't commit to wearing the faja post-op, don't have the surgery. That's all I can say. Also is like stopping a baby about the faja. Like, it is summertime, it has been like 80, 90, humid. I don't care. I effing love my faja. I love wearing it. I don't mind sleeping with it. I want to be secured at all times. Like I mentioned, don't hate on me if you are wearing one and you hate it. The bottom line is, with wearing your faja, is that you cannot get away with not wearing it, or not wearing it at night, or not wearing it because you just don't feel comfortable, or it's a little too tight, or it making you hot. You can't just not wear it and expect to get bomb results. Do not have the surgery if you feel like you're gonna complain about wearing a compression garment. Like, honestly, it is the tiniest thing that makes the world of results for your post-op, and I read a lot of things that I don't quite understand of, I hate to say it, women being babies about wearing it. And also I feel like the United States has catered to women being babies about it, about only wearing it for 8 to 12 weeks post-op, which 24/7, which in the DR, you wear this thing 24/7 or 23/7 for 6 solid months. Now, the next step after my 6 months of 24/7, which would be 3 months after that of wearing it 12 hours a day, and then it is an additional 3 months for 6 hours a day, or AKA, I'm gonna say it, if you really wanna keep your results, you're gonna wear your faja every night for the rest of your life. Like, honestly, not a big deal. I love feeling compressed, and I feel like I'm most likely gonna wear a compression garment like almost all the time in general. Now, I wanna show you what I'm looking like right now. Like, let's have a little fun. So naturally, I'm not wearing any pants, like duh, that's what we influencers do when we're video. We just wear a top. So I'm just gonna zoom out and do a little show and tell for you guys. Okay, so here I am. I am wearing some thigh compression sleeves that I got from Amazon, because I just feel like I need a little extra something, because often these fajas are a little short, so I'm just needing a little extra for my big, big thighs. Anyway, so here I am in my Soul Beauty and Care, which is the best faja in the whole world. I will go over all of it and compare and contrast for you in another video. Anyway, so what's nice about them is that they have custom fajas when you measure yourself. So in this one, I'm a small here, and then I'm a 2XL here. So let me just spin around so you can kind of see what's going on. They have the best butt pockets that really like pop out your booty better than any other faja I've ever experienced. like I mentioned, and just the construction is just so much firmer. And also, if you're in your process, like I never get bunching right here. I'm never having to pull this up like I am every other faja that I own. So I love it. I feel like it's just the easiest, and it's full zipper, obviously with the flap. So don't get nervous that you're going to zip up your little lady right there. It is the flap with the full zipper. Okay, so videos to stay tuned for will be all about fajas, and then also really great jeans that have been working for my new body. Of course, let me know if there's any other videos that you would like me to make. I'm all about doing it. So I super appreciate, again, all of you watching, all the positive comments, everyone who is embracing a change in their own life, either it being plastic surgery, a new job, a new relationship, or you just having the most amazing relationship with yourself, because that is number one. So I want to thank you all for watching, and we will see you soon. Bye.